Have you ever been told you snore loudly? Maybe you wake up with a dry mouth, a pounding headache, or your partner nudges you in the night to stop that train engine noise. Most people laugh off their snoring thinking it's just an annoyance or a harmless part of getting older. But what if I told you that certain types of snoring could be a red flag? One that's warning you about a much more serious risk, like a stroke? That's right, not all snoring is created equal. And for seniors, loud, gasping, or choking snoring can be a critical sign that your brain's blood flow is under threat. You might not feel any different, but inside your body, silent dangers could be building up each night you go to sleep. Today, I want to share with you the life-saving knowledge every senior and their loved ones should have. What kind of snoring signals stroke risk? What's really happening in your body at night? And most importantly, how can you protect your brain and keep living the vibrant, independent life you deserve? Stick with me to the end, because what you learn today could make all the difference for you or someone you love. Sometimes a simple change or a quick conversation with your doctor can save your brain, your independence, and even your life. Let's dive in. Why snoring matters after 60. We all know that as we age, our bodies change. But did you know that how you sleep, specifically how you breathe while you sleep, can be one of the biggest predictors of brain health in your later years? Let's get one thing clear. Not all snoring is dangerous. Many people snore lightly with no health impact. But if your snoring is loud, interrupted by choking or gasping, or you often wake up feeling exhausted, that's not just getting older. It may signal a condition called sleep apnea. Sleep apnea is a disorder where your airway repeatedly becomes blocked while you sleep. Each blockage drops your oxygen, stresses your heart, and makes your blood pressure spike. Over time, this nightly struggle silently damages your blood vessels, including the tiny ones that supply your brain. Scientists now know that untreated sleep apnea is one of the strongest predictors of stroke in older adults. In fact, it can increase stroke risk by up to 70%. That's why snoring, especially certain patterns, should never be ignored. Let's break down the difference between harmless snoring and the kind you need to take seriously. Real stories, when snoring is a wake-up call. Let's pause for a moment and talk about something that happens in so many households, often dismissed or joked about. Snoring that rattles the windows, keeps the whole house awake, and maybe even gets you banished to the guest room. It's easy to treat it as just a part of aging, or a funny quirk to tease your partner about. But sometimes, a family's good-natured teasing is actually the first clue that something serious is going on. Let me introduce you to 3 different people from different walks of life, each with a story that changed not only their own life, but also the lives of those around them. Story 1. Mary's second chance. Mary, a 72-year-old grandmother from Ohio, was famous in her family for her thunderous snoring. For years, her husband Jack joked about needing earplugs to get through the night. Her grandchildren made light of it during sleepovers, giggling every time she let out another growling snore. But things started to change one spring, when Mary began waking up several times each night, gasping for air. She noticed she was increasingly forgetful, misplacing her keys, losing her train of thought mid-sentence, even struggling to remember her grandchildren's birthdays. Her energy seemed to evaporate, and she chalked it up to just getting older. One morning, she awoke with a splitting headache and a sense of fog that wouldn't lift. Her daughter, worried by these changes, insisted Mary see a doctor. Reluctantly, Mary agreed, never imagining this visit would change the course of her life. After describing her symptoms, loud snoring, morning headaches, frequent waking, and worsening memory, her doctor ordered a sleep study. The results were startling. Mary had severe obstructive sleep apnea, with her breathing stopping more than 30 times per hour every night. Each episode robbed her brain of oxygen and sent her blood pressure soaring. With treatment, using a CPAP machine, making changes to her sleeping habits, and losing a bit of weight, Mary saw a dramatic turnaround. Her memory improved, she felt more energized, and her family noticed she was sharper and more cheerful. Most importantly, she had cut her risk of stroke nearly in half. Story 2. Robert's turning point. Now let's meet Robert, a 68-year-old retired engineer from California. Robert prided himself on his independence. Widowed for over a decade, he lived alone, spent his days tending his garden, and loved reading history books late into the night. But Robert had a secret. He often woke up gasping for air, his heart racing, drenched in sweat. His morning headaches grew so persistent that he stopped making plans in the mornings, and he found himself napping during the day just to get by. He brushed off the symptoms, convincing himself it was part of growing old. One evening, while video chatting with his son, Robert became confused and lost his words mid-conversation. Alarmed, his son called a neighbor, who rushed over and took Robert to the emergency room. Doctors quickly recognized the signs of a minor stroke, and further investigation revealed untreated sleep apnea was a major contributor. After this scare, Robert started treatment, joined a support group for seniors with sleep apnea, and began walking each morning in his neighborhood. He regained his energy, rebuilt his confidence, and made new friends. Most importantly, he learned that asking for help and listening to his body wasn't weakness, but wisdom. Story 3. Gene's family wake-up call. Finally, let's hear from Gene, age 75, living in rural Georgia. Gene had always been healthy and energetic, the rock of her extended family. But over the years, her snoring grew louder and more erratic. Her husband noticed long pauses in her breathing, but she brushed off his concerns. One night, after a family dinner, Gene awoke suddenly, gasping for air and clutching her chest. Her husband called 911, and in the ambulance, paramedics noted her low oxygen and high blood pressure. After several tests, doctors diagnosed Gene with severe sleep apnea. This moment became a wake-up call, not just for Gene, but for her whole family. Her children, inspired by her journey, got screened themselves. Gene's grandchildren now remind her to use her CPAP machine, and her story is a powerful reminder that snoring can sometimes be the first sign of something much bigger. Key takeaway: these stories are not isolated. Across the country and the world, millions of seniors are living with undiagnosed sleep apnea, risking their health, memory, and independence. For many, the only sign is snoring. If you or someone you love snores loudly, wakes up gasping, or feels tired no matter how much sleep they get, don't wait. Take it seriously, ask your doctor, and remember, knowledge is the first step to protection. The warning signs. Is your snoring dangerous? You may be wondering, how do I know if my snoring is just annoying or a sign of something much more serious? The truth is, not all snoring carries the same risk. Understanding the warning signs can mean the difference between catching a problem early and facing a medical emergency later. Let's break down the key warning signs and what they might mean for your brain health. 1. Loud, persistent snoring. If your snoring is so loud that it's heard outside your bedroom, or it consistently disrupts your partner's sleep, that's a red flag. Occasional snoring, especially during allergy season or after a late-night meal, can be normal. But when snoring is a nightly occurrence and shakes the windows, it's time to pay attention. 2. Pauses in breathing, gasping, or choking. One of the hallmark signs of sleep apnea is breathing pauses, often followed by a choking or gasping sound. If your partner or family member notices that you stop breathing for several seconds, then suddenly gasp for air, this is a warning that your airway is closing off during sleep, cutting off oxygen to your brain. 3. Morning headaches. Do you frequently wake up with a dull, pounding headache? Morning headaches are a common symptom of sleep apnea, caused by low oxygen levels during the night. This repeated oxygen deprivation damages blood vessels in the brain and increases stroke risk. 4. Daytime fatigue. You go to bed on time, sleep through the night, or think you do, but wake up feeling exhausted, groggy, and in desperate need of a nap. If you find yourself dozing off during the day, missing out on social activities, or feeling irritable for no apparent reason, your body may be trying to tell you something. 5. Dry mouth or sore throat. Waking up with a dry mouth or sore throat can be another sign that your breathing isn't normal at night, especially if you breathe through your mouth due to blocked nasal passages or a collapsed airway. 6. Difficulty concentrating, memory lapses, or mood changes. Sleep apnea doesn't just affect your body, it affects your mind. Lack of oxygen and poor sleep quality can cause problems with focus, memory, and even lead to depression or anxiety. Seniors often mistake these symptoms for normal aging, but addressing sleep problems can sometimes reverse them. 7. High blood pressure and uncontrolled diabetes. If you're struggling to manage high blood pressure or diabetes, despite medication and healthy habits, consider that sleep apnea could be an underlying cause. The stress and inflammation caused by repeated oxygen deprivation make it much harder to control these conditions. Scientific insights: why these signs matter. Doctors have long recognized the link between sleep-disordered breathing and an increased risk of cardiovascular problems, including stroke. Multiple studies show that people with untreated sleep apnea are significantly more likely to develop atrial fibrillation, an irregular heartbeat, high blood pressure, and even heart failure. All these factors further increase your risk of stroke. Case study: silent symptoms. Let's talk about Ed, a 70-year-old from Texas. Ed always prided himself on being sharp and independent, but over time he noticed small slips, forgetting where he parked the car, missing appointments, snapping at loved ones without reason. He attributed it to getting older, until his daughter, a nurse, suggested a sleep study. It turned out Ed had severe sleep apnea, with over 40 breathing interruptions per hour. After starting CPAP therapy, Ed's memory, mood, and overall well-being improved dramatically. This story highlights how symptoms can creep in slowly and how easy it is to mistake them for the normal aging process. Self-assessment: should you be concerned? Ask yourself or your loved one, has anyone told you that you stop breathing or gasp for air at night? Do you wake up feeling tired no matter how long you sleep? Are you experiencing unexplained memory problems, mood changes, or trouble concentrating? Are you struggling to control blood pressure or diabetes despite treatment? If you answered yes to one or more of these, it's time to speak with your healthcare provider about a sleep evaluation. Action steps: keep a sleep diary for a week. Note snoring, waking episodes, headaches, and how you feel in the morning. Ask your partner or family to observe your sleep for unusual sounds or breathing pauses. Take these notes to your doctor for a thorough evaluation. Remember, sleep-disordered breathing is treatable, and early action is the best way to protect your brain. What happens in your body? The silent nighttime threat. Let's take a deeper look at what actually happens inside your body when you have untreated sleep apnea or dangerous snoring. It's a chain reaction, one that starts with a simple airway collapse and ends with real damage to your brain and blood vessels. How sleep apnea damages your brain. Every time your airway closes during sleep, oxygen levels drop and your body goes into panic mode. Here's what happens. One oxygen deprivation, your brain, which needs a constant supply of oxygen, is suddenly deprived. Even a few seconds of this can cause cellular stress and trigger inflammation. Blood pressure spikes. Your body senses the lack of oxygen and releases stress hormones like adrenaline. Your heart pounds faster and your blood pressure rises sharply. These repeated surges damage the lining of your blood vessels, making them stiff and prone to clogging. Microstrokes and silent brain damage. Recent brain imaging studies have shown that seniors with untreated sleep apnea often develop silent strokes, tiny, unnoticed injuries that accumulate over time. These microstrokes can lead to memory loss, confusion, slow thinking, and eventually dementia. Increased risk of blood clots. Poor sleep and low oxygen levels thicken your blood and make it more likely to form clots. If a clot travels to your brain, it can block a blood vessel and cause a full-blown stroke. Disrupted brain cleansing. During deep sleep, your brain is supposed to flush out toxins and repair cells. Sleep apnea disrupts this cleansing, leaving you with a buildup of waste products that damage neurons. A major study from the American Academy of Neurology found that seniors with moderate to severe sleep apnea had twice the risk of silent strokes compared to those without breathing problems. Another Harvard-led study showed that treating sleep apnea reduced brain inflammation and improved memory, even in adults over 65. Story: Susan's transformation. Susan, a 66-year-old retired nurse from New York, struggled for years with memory lapses and anxiety. She thought it was early dementia, but her neurologist suggested a sleep study first. The results revealed severe sleep apnea. After treatment, Susan's cognitive function and mood improved so dramatically that she now advocates for sleep evaluations in every senior living community. Why nighttime symptoms go unnoticed? One of the greatest dangers of sleep apnea is that it's invisible, happening while you sleep. Unlike chest pain or a racing heart, you're not awake to notice breathing interruptions. Many people assume they sleep fine, even as their brain is being quietly starved of oxygen. It's not just your mind at risk. Untreated sleep apnea is linked to heart attacks, atrial fibrillation, irregular heartbeat, high cholesterol, type 2 diabetes, depression and anxiety. The good news? Treating sleep apnea with a CPAP machine, dental device, or lifestyle change can dramatically reduce these risks. Studies show that seniors who treat sleep apnea cut their risk of stroke and dementia nearly in half, regain energy, and often feel years younger. Don't accept brain fog, mood swings, or memory loss as a normal part of aging. If you snore, have any warning signs, or just want peace of mind, talk to your doctor. Your brain deserves protection every single night. Getting checked. Why sleep studies save lives. So you've recognized some warning signs. Now what? The single most effective way to diagnose sleep apnea is with a sleep study. Let's walk through exactly what to expect, why it matters, and how it can save your life. Types of sleep studies. In-lab polysomnography. This is the gold standard. You'll spend a night at a sleep clinic where professionals monitor your breathing, heart rate, oxygen levels, brain waves, and movements as you sleep. Home sleep apnea test. For many seniors, a home sleep test is just as effective and far more convenient. You'll use a small monitor that tracks your breathing and oxygen at home. What the test detects: number of breathing pauses, apneas, drop in oxygen levels, sleep stage disruptions, heart rhythm changes. Don't let fear or embarrassment hold you back. Most people are surprised at how easy and comfortable these tests are. Technicians explain every step, and you're free to move around and sleep in your usual position. After the study, a sleep doctor will interpret your results and share a clear diagnosis. If you're diagnosed with sleep apnea, your doctor will create a personalized treatment plan. Most insurance plans, including Medicare, cover sleep studies if symptoms are present. Many hospitals and clinics offer assistance programs for those without insurance. If you live in a rural area or have mobility challenges, telehealth options are expanding rapidly. Why does early diagnosis matter so much? Because the sooner you know, the sooner you can act and prevent permanent damage to your brain, heart, and independence. If you're hesitant, involve a loved one. Bring your spouse, adult child, or friend to appointments. Family can help with observations and support you through treatment. Real-life example: Frank, age 75, was initially embarrassed about his snoring. With his wife's encouragement, he completed a home sleep study and was shocked to learn he stopped breathing 25 times per hour. Now, with CPAP therapy, he's back to gardening, volunteering, and enjoying time with his grandkids. Action steps. Talk to your primary care doctor about your sleep. Request a sleep study if you have any warning signs. Don't delay. Your health and independence depend on it. How to sleep safely and lower your stroke risk. A diagnosis of sleep apnea can feel overwhelming at first, but remember, treatment is both highly effective and widely available. Let's break down your options, what to expect, and how these changes can transform your health and well-being. CPAP therapy, the gold standard. CPAP stands for Continuous Positive Airway Pressure. It uses a gentle stream of air delivered through a mask to keep your airway open while you sleep. Today's CPAP devices are quiet, lightweight, and customizable. Many models come with humidifiers, comfortable straps, and even ramp features that slowly increase pressure for comfort. Most people feel better within a few nights. Benefits include improved memory, better mood, more energy, lower blood pressure, and a dramatically reduced stroke risk. Work with your doctor or sleep specialist to find the right mask and settings. Give yourself time to adjust. Most people need a week or two to get comfortable. Clean your equipment regularly to prevent sinus infections. Dental devices, an alternative option. If your sleep apnea is mild or you cannot tolerate CPAP, a dental device, custom made by a dentist, can help keep your jaw forward and your airway open. These are especially effective for people who snore or have mild to moderate sleep apnea. Lifestyle changes that make a big difference. Weight loss, even a small reduction in weight, can dramatically reduce the severity of sleep apnea. Physical activity, regular walking, swimming, or gentle yoga improve airway muscle tone and overall health. Sleep position, sleeping on your side reduces airway collapse. Some people sew a tennis ball into the back of their pajamas as a reminder not to roll onto their back. Avoid alcohol and sedatives. These relax airway muscles and worsen snoring. Manage allergies. Treating allergies with medication or nasal sprays can help keep your airway open. Surgical options. In rare, severe cases, surgery may be recommended to remove tissue blocking the airway or to reposition the jaw. These procedures are generally a last resort, but can be life-saving for some patients. Long-term benefits. Stroke prevention. Treating sleep apnea can cut your risk of stroke by more than 50%. Brain health. Improve memory, sharper thinking, and lower dementia risk. Heart health. Better blood pressure control and lower risk of heart attack. Mood and independence. Less anxiety and depression. Greater ability to live on your own. Real-world story. Joan, age 69, struggled with CPAP at first. With help from her sleep therapist, she found a mask that worked, joined an online support group, and now enjoys restful sleep and renewed zest for life. Joan's story is a reminder that persistence pays off and that a good night's sleep is worth fighting for. Family support. Involve loved ones in your treatment journey. Their encouragement can make the transition smoother and help you stick with new habits. How to protect your brain every night. Every night, even if you don't have sleep apnea, or if your case is mild, there are steps you can take every night to protect your brain, lower your stroke risk, and age with confidence. Maintain a healthy weight. Carrying extra weight, especially around the neck, increases the risk of airway collapse during sleep. Action step. Focus on gradual weight loss with a balanced diet, lean proteins, whole grains, vegetables, and fruits. Support. Consider joining a senior walking group or community fitness class. Stay physically active. Regular movement strengthens muscles that keep the airway open and supports cardiovascular health. Action step. Aim for 30 minutes of activity most days. Walking, swimming, tai chi, or chair yoga all count. Motivation. Find a workout buddy for accountability and fun. Avoid alcohol and heavy meals before bed. Alcohol relaxes airway muscles and increases snoring. Heavy meals can disrupt digestion and sleep quality. Action step. Stop eating and drinking alcohol at least 3 hours before bedtime. Establish good sleep hygiene routine. Go to bed and wake up at the same time every day, even weekends. Environment. Keep your bedroom cool, quiet, and dark. Remove screens and minimize distractions. Relaxation. Wind down with calming music, gentle stretching, or meditation. Manage chronic conditions. Uncontrolled high blood pressure, diabetes, and high cholesterol all increase stroke risk. Action step. Take medications as prescribed, attend regular checkups, and work closely with your healthcare team. Monitor your sleep. If you notice new symptoms, louder snoring, more fatigue, or changes in mood, write them down and share them with your doctor. Build a support network. Share your journey with friends, family, or an online group. Social connection supports both mental and physical health. John, age 76, combined CPAP therapy with gentle walking and healthier eating. Within months, his energy soared, his blood pressure normalized, and he rediscovered his love for painting. Real stories of hope, seniors who transformed their health. These real-life transformations prove it's never too late to take action for your health. Case 1. Jim's journey to better health. Jim, 68, a retired bus driver from Florida, ignored his snoring for years. After a minor stroke, his doctor insisted on a sleep study. The results shocked him: severe sleep apnea. With his wife's help, Jim adjusted to CPAP, started daily walks, and improved his eating habits. Within months, his memory and mood improved, and he found joy in playing with his grandchildren again. Case 2. Dorothy's family support. Dorothy, 72, from Illinois, always put her family first and neglected her own health. After her daughter learned about the dangers of sleep apnea, Dorothy agreed to a sleep study. The whole family rallied around her, helping with appointments, learning about CPAP, and supporting lifestyle changes. Today, Dorothy is more active and connected than ever. Case 3. Thomas's new start. Thomas, age 75, from Arizona, had lost interest in his hobbies and was increasingly forgetful. After a sleep evaluation and treatment, he returned to his beloved woodworking shop and even started mentoring younger craftsmen. Key lessons. Support from family and friends is vital. Persistence leads to improvement. Seeking help is a sign of strength. If you or someone you care about snores loudly, wakes up tired, or notices any of the warning signs we discussed today, don't wait. Your next step could be life-changing. Talk to your doctor about your sleep. Don't be afraid to mention snoring or fatigue. Whelmy started knowingly, request a sleep study if you have any symptoms. Early diagnosis is the best protection. Share this video with family and friends. You could save a life. Embrace treatment and lifestyle changes with an open mind. Improvements happen quickly, and the benefits last a lifetime. Join our community by subscribing and sharing your story in the comments. We're in this together. Your health and independence are worth every effort. That's something we did a doing. Free on Siling. A good night's sleep is the foundation for a strong, sharp mind and a joyful, active life at any age. Remember, you have the power to protect your brain and add years of vibrant living to your life, one night and one choice at a time. Sleep well, live well, and never stop caring for your beautiful brain.